Dr. Aswine Bal, welcome to ITV Gold. Thank you so much for giving us your time today.
Thank you for having me.
Of course, we have to have you. You are a pediatric infectious disease specialist and I have a lot of questions regarding COVID in children. So let's go right into it. My first question to you has to be about this alarming rise of cases in children that we're seeing across the nation. I'm hearing the news that it's at its highest levels that it's been to since the start of the pandemic. How are you looking at this rise in cases in children, and what is the biggest cause of that according to you?
Well, in the beginning of the pandemic, there are very few pediatric cases because in general, from the studies shown that children less than 10 years of age, less likely to contract COVID infection or become sick. So we have a very few number of pediatric cases, but as you know, since mid-June, there is increased surge of the COVID-19 among US population. And for last, I think this month, there is sudden increase in pediatric cases of COVID-19 and a lot of hospitalization.
Yes.
It could be, as you know, right now, the emerging Delta variant is the predominant strain, which is much more easy to transmit to the other people. So it's more infectious. That could be one of the reasons. Also, the other thing is right now there is a lot of laxity in terms of masking and as practiced before, and overcrowding. That could be one of the factors for the increased spread of COVID-19, particularly the new variant, which is Delta variant, which is much more easy to transmit to the other people.
Yes, let me ask you the million-dollar question. Do you think schools that are opening across the country are adding to the spike in cases? What have you seen so far?
Well, right now the schools actually on break. So there are few schools open, I think, late summer. And I don't think any of the school in Northeast has opened so far. I think most of the schools will open in September. So I don't know that has any effect. I don't think most schools in this area are not open yet.
Right, so but across the country, doctor, schools have been opened, such as in states like Florida, and where a lot of students have to now go into quarantine because there's been a huge exposure of COVID-19. Do you think in those states it's causing a spike going back to school and not wearing a mask and not having a vaccine mandate?
You know, when CDC and American Academy of Pediatrics recommended this fall, all the students need to go to in-person learning because that's really more effective and that's better for the mental health of the children. It was meant that most people will get vaccines, particularly the adults and anybody more than 12 years of age. Plus, there are many layers of preventive measures taken by the school to prevent transmission in school environment. But there is a whole list of things that schools need to practice to prevent transmission. And there studies have shown that if you use good ventilation system, maintain social distancing, and universal masking, you can cut down transmission by almost 50%. That has been studied in many elementary schools in Georgia and other places. But many states have a different rule in terms of masking and mandating masking in school. So that could be the states that are liberal in using like mandating mask in school. That could be a factor right now or will be a factor in future for the schools, those who don't mandate masking, universal masking of the students, teachers, and the staff in the school.
Yeah, and it's so important to note that a lot of children are not even eligible to get the vaccine. So wearing a mask is probably the only way of protection. Let's talk about vaccinations in children. My first question to you has to be, do you think we are vaccinating enough children in the country? How are you looking at that?
I think we're not vaccinating enough adults. So that's the first thing. I think that a lot of parents were anxious and misinformed about the vaccine in pediatric age group. As you know, the Pfizer vaccine is approved for anybody more than 16 years of age.
Yeah.
But between 12 to 15, it's also approved for emergency use authorization. So it can be used. The vaccine is safe, effective in preventing serious disease, and it also works for even variant strains, including Delta, even though it can have a breakthrough infection. So it's basically, I think more and more parents are motivated towards getting their children vaccinated. But I think the education coming from the pediatrician at the community level, schools, school system, and the national guideline like a CDC and American Academy of Pediatrics actually increasing motivation among the parents to get their children vaccinated for COVID-19.
Right.
But
Go ahead.
so that is, so we don't know what percent of the children are already vaccinated. I think my guess is more and more children are getting vaccinated, but not enough.
Yeah. A lot of the parents on this getting their children vaccinated, especially from 12 to 15, are scared about either the issue of the inflammatory disease or the rare heart disease, and they're also worried about the development of their child. So could you please answer to those things and tell us, how does that impact the body, and is it still better to take the vaccine?
I think considering the risk and benefit, it's worth taking the vaccine than taking the risk of contracting COVID-19 illness. There are some rare cardiac conditions called myocarditis, which happen in young people, including adolescents and young adults, after second dose of Pfizer and Moderna vaccine. But the incidence is low, and it's not a severe cardiac condition. So it's not really a common or severe condition. So I think that should not be a major factor in not vaccinating children.
Yeah, definitely. I think Do you believe the benefits outweigh the risk when you're looking at vaccinations in children above the age of 12?
Definitely, because right now the most vulnerable population is less than 18 and particularly less than 12. But as you know, like when you leave a bunch of susceptible people in a community, there is a virus circulating. Those are the people who will get it. So children unvaccinated below 12 years of age are at higher risk. So I think, we don't have an approved vaccine in children less than 12 years of age.
Right.
But I think that study is ongoing, so hopefully they will be available soon.
Yeah, of course. I was just about to ask you that we're hearing the news that from 2 to 11 years old, there could be a vaccine available for them late fall. And then we're looking at 6 months to 2 years also, its vaccine trials are going on. Can you give us more insight into what they're checking and what will happen with the dose of the vaccine for this population of children?
Yeah, it's basically, it's very hard to go through the dose by age in children, because in adult it's a single dose.
Right.
But they're trying to make half of the dose for the children, but it's very hard to do a study making dose for every child by age. So I think all they are looking at, since there is not much, it's not dose dependent side effect, they are trying to make sure that the dose we are giving is making antibody that will prevent the disease. So it's basically a lot of details of these vaccine trials are not known. But I think the target group right now, they're working between 12 to 5 and then between 6 months to 5 years of age. The younger the patients are, they're trying to be more careful in terms of side effect and the dosing. So that's why it's taking longer compared to the adult vaccination testing.
Right. So it's so important, again, to get your child vaccinated if your child is eligible. Let me ask you another question, doctor. Do you think children that are not vaccinated can infect they're already vaccinated parents? How does that work?
Well, if it is like a Delta strain variant, people who are already vaccinated with either Pfizer, Moderna, or J&J, they still can contract the infection and can get sick. And even people who are vaccinated, if they have Delta strain, they can pass on to somebody. So if there is a circulating strain of Delta variant, if it's isolated, and they can give it to the parents also. But the good thing is people who are vaccinated adults, even though they contract Delta strain, they still don't become very sick because the vaccine has significant protection to develop any kind of severe illness.
Yes, of course. What do you say to parents that are still hesitant right now and are, they may be vaccinated themselves, but their child isn't vaccinated? What do you say?
Well, the vaccine antagonist or vaccine hesitancy is not something new. There's a group of people who have many misconceptions or bad experience, or they don't try to get their kids vaccinated again. Routine vaccination, which are very important to prevent serious diseases. Same thing applied to the COVID, but this is a new disease, this is a new vaccine. So a lot of people have fear plus hesitancy. And there's a lot of misinformation circulating among in the community that it can cause some of the adverse effects, which are basically not scientifically proven. So it's basically educating the parents at grassroots level when they go to the pediatrician and getting information from the school system, and also the agency like Centers for Disease Control and American Academy of Pediatrics can make them comfortable to get vaccination or motivated to get the vaccination, vaccinating their kids.
Right. So let me ask you this. You're meeting parents that may be hesitant. You're seeing children cases increase as well. Are you also seeing children end up in the ICU more as well? Are they getting critically ill from this COVID-19 disease?
When this started in the beginning and the pandemic, there are not too many children required ICU admission, and there are very few children who are admitted in the pediatric age. But as I heard in the news today, there is some Southwest and few areas, there is a lot of pediatric ICU admission increase. I think eventually if this Delta strain is much more virulent than the original strain, it's more transmissible. So more, and since more children are getting infected, obviously you can expect that there may be more severe illness requiring intensive care admission or hospitalization. But again, that's a guess. But right now there is a surge in hospitalization for the pediatric COVID cases.
Right.
Yeah,
let me ask you something. What's your biggest fear in this whole situation? If I was to ask you what's the worst case scenario with children and COVID going into the fall, what would you say?
It's an evolving disease. So meaning that pathogenesis, meaning that the disease caused by this virus is very variable, from mild symptoms to no symptoms to severe symptoms. And some of these effect of the COVID-19 also is very rare, late side effect, and some of them can be severe. And in children, we see something called multisystemic inflammatory syndrome in children, which is a serious condition, which happens several weeks after somebody gets COVID-19. But that can affect the heart, and they can affect circulatory system, kidney, multiple organs. So it can be serious. The fear is if that condition happens more frequently, so the children will be much more sick, particularly if they have COVID-19 infection. So some of the complications that can happen immediately during the illness or many weeks after the infection still in the horizon.
Right. Right. Do you think this vaccine should be a required immunization for children? You know, we have required immunizations for various vaccines for children before they go into school or colleges. Do you think this should be a part of that?
Well, if you look at vaccine mandatory issues, it's primarily through the employer, the hospitals, so people can make them to take it as a requirement for that job.
Yes, of
But
course.
the same situation doesn't apply to the children. It's also become a political issue to force somebody to immunize their children, which is, has been always an issue for pediatric vaccination. So answer to your question about mandating COVID vaccination among children once it's approved, it has a lot of political and ethical issues which will be debated over over a period of time, and many states may deal with it differently. But I don't know, mandating a vaccine or like a COVID-19 vaccine would be easy.
Yeah. But how are you looking at mandating masks? And I ask you because it has become a political issue, doctor. There are states that are banning mask mandates in schools, even though cases in children are rising. How does that make you feel as a medical professional?
I still personally believe that, if you look at some of these studies, even before vaccination, if you just maintain social distancing and universal masking in children, it can significantly decrease transmission of coronavirus in school system by 50%. So since most of our young children is not going to get vaccinated soon, anybody less than 12 years of age, and they're susceptible, and in our community the virus is spreading, I think mandatory masking probably a requirement at least to attend school. So somebody can make that. But again, this has become issue in many states because the governor and the politicians decide those things for the state, which varies from state to state. But I think mandating it will be difficult, but educating the people about the importance of it by scientific evidence, by at a community level with coordination from the state public health department, local public health department, school system, pediatrician. I think all these education for the parents will help them to get their kid used to the mask, and particularly once the school opens, it will be a new experience. We'll probably find out over the next few months if this strategy is going to be an issue in spreading infection.
Okay, 2 more questions left here for you. I have to ask you, flu season is upon us, doctor. Flu shots are going to be available, or they might already be available. How important do you think it is for children to get the flu shot this season?
As you know, the influenza is seasonal, and the season is coming. So the vaccination is not always 100% effective, but it significantly reduces the infection and also severity illness. And so by vaccinating children, because during these months when COVID-19 is going around and the influenza season overlaps, and any child with a fever, cough, it's hard to differentiate on the early symptom whether the child has COVID-19 or influenza. So by vaccinating for influenza, it will cut down that risk of some of the children who will not develop influenza. So the less number of people will need to be screened or it may issue. So while the 2 respiratory viruses going around at the same time, if we can prevent both of them, then it will be ideal. So I think influenza vaccination is very critical among the pediatric age group, anywhere more than 6 months, to add another insult of respiratory infection in addition to COVID-19.
Right. Again, vaccines only prevent from severe illness is what I'm getting from you from most of this. My last question to you has to be, I'd like for you to give us a prediction for the next couple of months when you are looking at pediatric cases. What do you think is going to happen in the Northeast, and what do you think is going to happen in the South?
It's hard to say because we're not aware of all the states' requirement. Obviously, it needs to be watched very vigilantly by public health officials, both state level, local level, and CDC level. It's hard to predict because this virus circulating in the community, nobody can predict if it's going to surge or is going to go down. But I think it's better to be prepared for the whole situation and take all the precautions, including vaccination, mandatory masking, social distancing, and taking all the precautions, hand hygiene, to prevent this. So I don't have any prediction for over the next few months in either South or Northeast.
Okay, but it's important again to use those preventive measures, to wash your hands regularly, to practice social distancing, to wear your mask. It has only helped us since last year. Dr. Bal, thank you so much for your time today on ITV Gold.
You're welcome. Thank you for having me.